Good morning, everyone, and welcome to this special edition of Equity Matters. I'm Fawn Rhodes, the New Hanover County Health and Human Services Equity Coordinator, and I'm so glad you've joined us today. Equity Matters is a space where we explore how and why we practice health equity, both in the workplace and in our communities. We highlight the programs, partners, and individuals who are doing the work to advance equity in North Carolina and beyond. Today, we're diving into a critical topic, data equity, and why it matters for healthy human services. Data tells the story of our communities, influences policy and funding, and ultimately shapes the health outcomes of the people we serve. But when data is incomplete, inaccurate, or biased, entire communities can be left behind. And we've seen that in the past, in the present, and hopefully not in the future. That's why I'm honored to welcome our guest today, my friend, Dr. Dietrich Epps, a distinguished expert in using data to achieve results for people and community. Dr. Epps has been a champion for fair and ethical data practices that ensure every voice and experience is counted. Dr. Epps, thank you for joining us today. Before we jump into our discussion, can you share a little bit about your background, where you're from, and what led you to this work?
Certainly. Thank you so much, Fawn, for the opportunity to join on this important conversation today. Oh my goodness, I'm already excited about this conversation and people who are joining. I see someone just joining from Baltimore, where I lived for over 20 years. So that's exciting to see.
Mhm.
My name is Dietrich Epps. I'm the president and CEO of Race for Equity. We are a global management consulting firm,
Mhm.
and I am living in Durham, North Carolina. But I want to share that our work takes us all over the world. We are very focused at Race for Equity on developing collaborative actions to achieve equitable impact. So that's what we do. So collaborating, not just from New Hanover today, but you inviting folks into this conversation is important. We help people to transform data into meaningful change for people and communities. So
Mhm.
that's a little bit about what we do, and we'll talk today about data equity. As I mentioned, I lived in Baltimore for quite some time, for about 20 years. But
Mhm.
when I moved to North Carolina 11 years ago, like a salmon. I didn't know it, but I came back to the place of my maternal ancestry. And so
Yes,
my family has roots in New Hanover County. So
it
I'm
does.
especially excited to be here today. So I'm shouting out any Corbett family members that are in New Hanover, and just really super happy to be here today, Fawn.
I'm so glad. I'm so glad. This is going to be like a fireside conversation between you and I because we're so connected. So this is such an easy day for us, and people will just get a inside look at how we communicate with each other. So I love the fact that we're going to be able to have this conversation. We thank you who are joining us. I see someone has joined from Baltimore, someone's joined from Biloxi, Mississippi, someone has joined from Wilson, North Carolina. So if you're all in the chat and you want to place where you're from and what position or organization that you're with, please do that. It's not required, but that'd be fun so we can see where everyone is from and maybe someone can make a connection in the chat. Networking is always a great opportunity to build relationship and see if we can work together on things in the future. So thank you so much for joining and speaking in the chat. So let's get right into it, Dr. Epps. We are in a time right now where data is one of those things where I always like to say data drives dollars, right? What did they say? If it don't make money, it don't make sense. And so we have to really look at how we use our data and how the data that we're getting, is it accurate? Is it inaccurate? Garbage in, garbage out, right? So we have to be thoughtful about how we utilize data. So our first question that I have for you today is what is data equity and why does it matter in healthy human services?
Yeah, so data equity it really does help to make sure that data is collected throughout the process of data, starting at the collection of data to analyzing the data even preparing what the questions that will be asked of the data, making sure that all of this is used in a way that is fair, it's inclusive, and that it's representing all communities. So today we're talking about New Hanover and beyond, but let's focus a little bit on New Hanover, right? When you think about the community of New Hanover, there are lots of folks in New Hanover from different experiences. And so if we're not looking at everyone in New Hanover, we will not have data equity. So without it, you're going to have disparities, and the disparities are going to persist. The inequities are going to get worse. And so I want to start by talking about what do I mean by disparities, so that
Yes.
people can really understand that we hear these terms a lot.
Hmm.
And I want to start by breaking down these two terms, disparities and inequities.
Hmm.
So, data equity matters because we know that there are disparities, there are differences in health outcomes between groups.
Hmm.
These disparities tell us what's happening. For example, in New Hanover County and many places around the country and the world, there are certain rural areas that have limited access to healthcare facilities, right?
Hmm.
So this is a known fact. And this leads to higher rates of unmanaged chronic conditions, chronic disease conditions. This is called a disparity.
Hmm.
Now, the inequity happens when there are systemic and avoidable factors that can cause these disparities, why they happen. Let me give an example. Uh, Most communities that are rural, the residents have a lack of public transportation. I'm sure it's the same in New Hanover, right? A lack of public transportation to reach healthcare facilities. And so this transportation barrier is actually an inequity that will contribute to health disparities. So that's why data equity is important. Fawn, I'd love to share a visual example and highlight some great work that has happened in New Hanover. As I was doing my preparation for this webinar, I want to congratulate you and the work that has happened in New Hanover County around the GIS technology that you've
Yes,
used. And I understand it's award-winning project. So if it's okay, I'd like to share screen for a moment. I'll talk
absolutely.
about it and then I'll share the screen. Is that okay with you?
Yeah, thank you. Hmm.
All right. So in New Hanover County, what I found and so excited to share with everyone today is how the officials there have used GIS technology to map food deserts. Now, GIS technologies is an exciting way that you can map out. It's data. You can see a map of the community, and then within the community, you can show with darker spots or lighter spots where the food deserts are. And this
Hmm.
is what the New Hanover County has done. And this is showing that um, you can then say, oh, this is where there's not that much food, grocery stores in this area of this county.
Absolutely.
And so you can look at the map and then show which communities need to have better access to food. And
Hmm.
this is an example of data equity,
Hmm.
addressing some systemic barriers. So I'm going to go ahead and share screen so that we can get a look at what this looks like.
And so, just giving you some background on that.
Yeah, sure.
Uh, around, I guess it was around when we were coming out of COVID, we were determining that many of the extra benefits that our community was going to be receiving from SNAP EBT benefits, our federal government decided that they were going to close and end those services. So, what we wanted to do was to determine in our community resources or find resources that we could point our community to, so they would not be in a challenging situation. So with that, what we gathered a team, myself, Miss Linda Thompson, those from our human services side, also our GIS team, and so we end up finding out as we were doing the study that what we thought were the places that we traditionally thought that were experiencing inequities or disparities was completely not. That those particular parts of the community actually were over resourced. We had more food banks in the central part of New Hanover County, more in our urban part of New Hanover County. We had more food banks in those spaces. But what we then found is in our outskirts of New Hanover County, those were less places that did not have food banks in those areas. And then we also found out in terms of population, speaking to particular populations, we found that white women who were between the ages of 25 to, I want to say like 40, single white women, that they were the ones and their children who were the ones who were experiencing inequity at a greater amount or a higher prevalence than other population sets. And then we also found that our elderly were actually experiencing a higher prevalence, excuse me, of inequities when it came to lack of food in those areas. So this prompted us to then reach out to our food bank and begin to offer services on how you could start a food bank in your area, and then also just do maps and ways that people connect it can plug into food resources within New Hanover County.
Thank you for that beautiful overview. And so, Race for Equity, RACE is an acronym that stands for Results Achieved Through Community Engagement. And the example that you just gave is what we will always do is start with community, right? So when you just spoke about community, what Fawn shared is, and we'll put a link to this in the chat so you can, so our viewers can learn more about it and take more time to see how you might learn from this more deeply. But I want to share with you what the GIS looks like. So this is a summary of what Fawn just shared, right? And so during COVID-19 and health equity initiatives. And so when you look at what data equity can do, this GIS map exposed those inaccuracies that Fawn was just describing. And then I do want to mention the Chief Equity Officer, Linda Thompson, that you
Yes.
mentioned here, and give credit to her and her team that you mentioned as well. But these are the maps, right? So when you think about data equity, the maps tell the story, and
That's
it
right.
shows where the grocery stores are. It shows poverty density, like and where the people who were living in poverty are, and then it shows some equity challenges. This is a beautiful example that we can highlight in as a living practical example of how to use data in an equitable way. So this is sharing where people live, where there is poverty, and then where are there grocery stores near or food banks near or far from these areas of poverty. So wanted to start off today's webinar by congratulating you and the team in New Hanover County for that really wonderful example of how data equity, as a local example, can how data equity can make a difference in where you put your services. So, and this is personal to me because my family is from this area as well. And so we know that disparities can impact our communities.
Mhm.
And when we push for data equity, we're not just talking about numbers. We're making sure that people are seen and heard and supported. So that's what data equity is all about.
And I love that you were able to use a real example for our community to be able to see how this actually plays out. We always want to make sure that the conversation that we're having is in a very literate type of way, that we're not speaking above our community and using terminology that is public health centered or internalized, because it's one thing to hear something, it's another way to understand it. So we want to make sure that we bring understanding in all the things that we're doing. So I thank you for sharing that and also explaining what disparities are and what inequities look like. So going to our next question, how does inaccurate or missing data affect our communities?
Well, if communities aren't counted, the way we just saw in that map was a way of counting. But if communities are not counted, they're not going to count in decision making, right? And so
Mm,
underrepresented groups are going to lose funding.
Hmm.
They're going to lose services, and they're going to even lose political influence. So when data is incomplete, the entire community becomes invisible because
That's
that
right.
they're not showing up in as here I am, right? Even the census data is an example of that. Taking the
Mhm.
census is extremely important so that
Yeah.
people can see where people are living within your community. And we know that the population, our representation in government is based upon how many people live in our communities and
That
who
is
are
right.
residents of that community. So this
Mhm.
is especially true of rural areas and indigenous communities. And so for example, the U.S. Census undercounted American Indians and Alaska Natives by about 5%.
Oh,
And
wow.
this leads to fewer healthcare resources, underfunded schools, and lack of political representation. There are Native American and indigenous communities still here in North Carolina that are vibrant, thriving communities. The
Mhm.
Hallawasaponi tribe is not too far from where I am, the Occaneechi Band of the Saponi Nation. Like if you're representing a tribal community today, please put it in the chat because we want to see you. We want to know, we want folks to know that these representatives from tribal communities are still here in our society, living, breathing, thriving, and
Yeah.
contributing.
Mhm.
And so in parts of New Hanover, and as well as other parts of the country, there are oftentimes limited broadband access. And this
That's
means people can't be connected to digital health efforts like the telehealth that we see happening now. Since COVID, it's become, very common to have telehealth.
mhm.
But sometimes when people don't have transportation and they don't have broadband access, this can be gaps in funding for telehealth programs that is very necessary. So if policymakers don't see the numbers, they're going to assume that there's no problem, and that's going to prevent
Yeah.
some real solutions from being put in place.
Yeah, that is excellent in how you frame that. Because when you think about this, one of the things I was thinking about is when you were talking about telehealth, when we don't have data to represent population sizes and in the communities that are there, not only does it prevent you from having, let's say, telehealth services, but it also prevents you from access to traditional like 911 services, right? Because why would
Yeah.
they run those lines deeper into those communities, and able to could they track you? Can they find you if you're calling and you need 911 services, but the maps are not showing up to show you that this is the part of the community that is there? All of that is tracked through data. Also, when you were talking about a voice, also in the New Hanover County area, just right across the river, we have our Waccamaw community, which is our Waccamaw Tuscarora tribal community that is in
Mhm.
Bladen County and Columbus County, and also our Lumbee tribe in those areas. You're correct. We have to make sure that we are including all of our communities, and we are making fair use of the data that is being utilized to them, and not using the data for our own personal interest, and using the data to ensure that it is um, that they're receiving proper funds, and that they're receiving good services in those areas. So all of the examples that you're given are really, really good. It also makes me think about, if no one hasn't had an opportunity, there's a book that I would encourage you to read. It's called The Political Determinants of Health. And the author is the author is Dean Daniel Dawes. Well, he's my dean, so Daniel Dawes. And he makes some really, really good um, points about why it's important for you to understand why data is so important, and why it connects to the political determinants of health, which actually is some of the reasons why we have to learn to be more engaged in our communities. So I love how you made all those connections together. Our next question is, how can Health and Human Services professionals and local organizations use this data to improve in real world outcomes?
So I want to thank folks for contributing in the chat. Feel free to share information in the chat. That's wonderful, about resources that are there. And welcome to everyone who is just joining. How can health and human services professionals and local organizations use data equity to improve these real world outcomes that we want to see? Well, first of all, organizations must begin or continue the great work that happened over the past several years, where we began to really look at the data and break the data down by populations that we're serving. And the first step is to know who is in your community and to understand what are their differences. Not everyone in your community is the same. Even if they look the same physically,
Mhm.
there are some differences within that community. So the first step is to use a culturally responsive approach to
Mhm.
collecting the data. And that means that when you're engaging the community in the collection of the data so that the community knows, the people in the community know their community, right?
Yeah.
And so when we engage them to say, where do we, first of all, hiring people from the community is very important.
Mhm.
Bringing in local folks to do the local work, qualified local people, and then helping to collect the data in a way that is culturally sensitive and aware and responsive. So when you
Mhm.
have community members collecting the data from their own community, people are going to be more open to sharing their information and their data in honest and transparent ways. So using a culturally responsive approach, having participatory collection of the data, and then this is going to help to have community driven decisions because the community is engaged throughout the process. Results achieved through community engagement. That's who we
Yeah.
are, right? So, um, health departments, for example, and organizations need to partner with the community instead of just collecting data about them.
Mhm.
That is going to make a huge difference. The community will be able to say who's missing from the data. Well, did you not? There's a whole neighborhood of folks. They'll tell you there's a whole neighborhood over off of Southern Street. Like, have you seen over there? There are a lot of people who have moved in. They will tell you what's happening in their local community.
Mhm.
Also, if surveys are only in English, non-English speakers are going to be left out. So we need to make sure that surveys are available in the languages, of the preferred languages. Are we using the right methods? Indigenous communities and communities of who have more oral tradition, the storytelling is very
Yes.
important. Being able to capture the stories. You can do this through a focus group. You can have a culturally responsive survey where people can give open answers,
Mhm.
can say their answer instead of having to write it out or type it out. This is going to help to make sure that there's better representation in the data. And we
Mhm.
want to listen, not just collect a whole lot of data. We want to listen, and data equity means acting upon what the community has said. Like,
Mhm.
too often, surveys are sent out, data is collected, and then the results, the strategies are the same as before the data was collected from the community. So,
Right.
what has been learned in that instance?
Mhm.
Organizations need to show that they're both receiving the data and then doing something with the data based upon what they've heard. So that's a very important part of data equity. In North Carolina and around the world, we do a lot of work in California, and the community health workers. There's a whole national community health worker association, right? So
Yes.
across the country, there are community health workers. And there's an association. If you don't have community health workers, they'll help support you in understanding how to bring them into your community.
Mhm.
Pastors are trusted messengers. All
Right.
of these folks are going to do a great job of gathering better data on, for example, on chronic disease management, because people are going to be able to talk to these folks a lot more easily and fluently, and without having a guard up if someone is
Mhm.
from their community. And this approach is going to help improve accuracy and help design interventions that work instead of just designing what we call evidence-based interventions that may not even work in your community.
So, I love the examples that you gave And when you're talking, could you go a little deeper when you were speaking about a culturally centered approach, and giving an example of a culturally centered approach for collecting data?
Sure. Well, I'm currently, I'll give an example of some work that we are doing. Again, results achieved through community engagement. So that's what the example will be. We are working with the state of California, some um, health initiatives around Medicaid in California.
Mhm.
And we have supported some of the state agencies who have recently begun to have doulas as Medicaid providers. So
Okay.
I'm a doula. I'm excited to share I'm a doula.
Mhm.
And doulas, I learned that doulas can play a critical role in improving birth outcomes for the person giving birth and as well as for the baby, right? So
That's right.
doulas are important in this process of maternal health equity. So in California and in some other states, doulas can be paid through Medicaid. North Carolina is also talking about this, and we can see where,
Yes.
hopefully this will be a great next step. So what has happened, the state wanted to hear more closely from the doulas and community across the state of California, which is a very large state, right? Lots of folks in California from diverse backgrounds. So our company, Results Achieved Through Community Engagement, was brought in to help, and actually a philanthropic organization, so philanthropy can play a role with this. A philanthropic organization, um, the California Healthcare Foundation, helped to support this. Us in facilitating conversations between the state departments, the doulas, the Medicaid, the managed care plans, like all of these partners who have a role to play in this Medicaid benefit, right?
Mhm.
And
Mhm.
so the data about what's happening across the state needed to come from the doulas themselves, because
That's
the
right.
doulas are the ones who are experiencing the day-to-day life of being providers. And so the data that the state is now using, and we're helping to facilitate these doula stakeholder work groups, the data that the state is using is coming from the stories of the doulas themselves. And then the policy was developed along with the doulas, along with the Medicaid managed care plans, and along with other partners that have a critical role to play. So now the groups are looking at the data together on enrollment of doulas and talking about how well the enrollment is going and where are their gaps. So all of this has happened because we have taken a culturally responsive approach to looking at the data, bringing the partners together to say, is this data, the numbers, how do the numbers align with what we're seeing in the community? And then what are we now going to create as strategies for improvement?
Mhm. Mhm. I
So
love how you
the
gave.
equity is both quantitative and qualitative, and it must include the voice of people from the community who know what's happening on the ground.
I love how you're giving those real life examples because people need to be able to, when we're talking about these different types of approaches, how do I take this and really make it applicable into my area? And then how can I duplicate it or find information about it and make it make sense for my community? So I thank you so much for sharing those examples. As you were going deeper into the research that you're working with the state of California, was there anything that surprised you as you were going into assisting and working with them? Did you find out anything that was very unique?
About the data
Mm-hmm.
or in general? Okay, so something unique about the way the state of California is approaching this work. I have to give a shout out to the team at the Department of Healthcare Services who had the insight, and the legislature who had the insight to require that this department have a doula stakeholder work group. It's actually legislated in policy
Oh,
that this
wow.
work group exists. And so the work group is made up of about 30 partners across the state from different, who all have a role to play in advancing and improving the doula Medicaid benefit. And in addition to that, they open the meeting. It's a virtual meeting. So the meeting is also opened up to the public. And so it's a unique design. We are a global management consulting firm, so we're facilitating virtually. Just like we have people, I saw someone from Canada on the line too. So
Mhm.
just like we're facilitating virtually, people from across the state of California can join and listen in and comment. And so it's a public forum across the state, but the doula stakeholder work group has the ability to speak verbally and to comment verbally. And so, but it's engaging the state community at large, as well as the doula community, as well as the managed care plan community, so that the design of it has been very inclusive. And that's what I'm going to say. That's what brings about a sense of belonging. That's when people can see themselves in the data. That's when people feel heard and seen, when their voice is up at the table making comments, but also the comments lead to decisions for change.
How can I tell if the data I see online in news reports or on social media is biased or incomplete?
Yeah, not all data is neutral. There is bias. Bias exists in how it's collected, how it's reported and interpreted. You know, we try as scholars and data collectors and survey makers, we try to leave bias out. You know, it's impossible to have, you know, everything without any bias, but we have to work towards recognizing our own bias and then responding to correct because of our bias. So when you're looking at data, you always want to ask, first of all, who collected this data?
Mm.
Right? So when someone's just says some numbers out loud, right? Think about the beginning of this webinar. I pulled up a map, I showed you the data, it showed who collected the data, right? All of that was right there.
Mhm.
A lot of times when you're seeing these numbers online and in the news reports and just shared in press conferences, the source of the data is not shared. So the
Mhm.
first thing you want to do is think about who collected this data, or who's and what is their agenda. There are some people that even, you know, even in buying products, when you're watching television, and they'll say 9 out of 10 dentists approve this toothpaste. And then at the bottom in the fine print, you'll say, you know, the dentists were hired by, you know, look at that fine print, you know, they have, who hired the dentist who did that survey? And was there a financial benefit for the dentist who did that survey, right? So
Yeah.
think about who collected the data. What was the agenda of the person who collected the data? Also, what is missing from the
Mm.
data? If people are only reporting on a certain population, what's happening with the rest of the community?
Mhm.
We work a lot in the maternal health space. And there were some comments made recently about, you know, that someone said, America is doing fine with maternal health if you just don't count Blacks and others in that. Well, if we only looked at the large number of how America is doing, that's not including the people who are doing poorly. And
Mhm.
guess what? If we compare the data on maternal health outcomes in the United States of America, even when you look at people who are race identified as white, if you look at other countries, America is doing far worse than other countries. So we can't just compare and look at one group and say if a group, if a community is doing well or not doing well. We have to think of who's missing. Are all the differences counted for? Economic differences, the geographic differences, the way we saw on that map, the race and ethnicity differences. All of these things are important. And finally, how was the data gathered? Right? Was it participatory, the way I spoke about a few minutes ago? Did community members participate in the data? Or was it like a top-down approach? A lot of times academic institutions or even sometimes philanthropic institutions will go into communities and extract data, and community members are not involved. So how that information, I mentioned this earlier, how that data is gathered is very important. So if the report says we have a maternal mortality review committee in North Carolina, and many states do now, but let's say a report says maternal mortality rates are improving, but it doesn't break it down by race. We might miss that Black and Indigenous people who are giving birth are still facing much higher risks. So we want to check the sources to make sure that we're getting the full story. So that's how you can think about when you're looking at data online or in the news or social media, right? It's so easy to say. I mean, I could sit here right now and say some percentages and numbers, and I could talk about transportation in Durham. I don't work in transportation in Durham, but I could give some numbers and say something about transportation based upon what I know generally about transportation, because I know it's frequently a barrier. But you notice I didn't quote any percentages or numbers. I simply said transportation is often a barrier in communities, especially rural communities, when you're trying to get to hospitals. But imagine if I had put some percentages behind that. Wouldn't I have sounded like, oh, very informed? And people will do that with numbers, because most of us will not fact check. When we hear someone in authority saying something, I have these two letters, DR, doctor, in front of my name. So because of that, people will think when I say numbers that those numbers are correct. I could say some numbers because I'm in a webinar and they could not be factual, but I'm not going to do that, because one of our core values, when we talk about results achieved through community engagement at Race for Equity, we have integrity as a core value. And so when you have integrity, you're not going to give out false information in a news report, on social media, and we all have a responsibility to make sure that the data that we're sharing, especially in this field, is accurate and credible.
I love that. That drives right into the next question, and that is, since we're understanding how utilizing data can impact us if it's incomplete or biased. So, where can I find trustworthy data sources that can reflect the real community needs that we have right now? One of the big conversations that people have been having over the past 10, 15 years, and I'm sure you know this, is about the social determinants or the social drivers of health, right? The social determinants or social drivers of health are the things in our socioeconomic environment that impact how you live, work, play, worship, interact, and just do life together. So understanding that, where would you suggest, or where are some credible resources or trustworthy resources that we could utilize to collect data from in our local communities?
So I will say that reliable data sources do include our government agencies. We are currently in a data, many people are panicking because some of the reliable government agencies that have typically shared data, like the Centers for Disease Control and Prevention, I'll give an example. These data sources are being shut down or paused, right? And so, but the government agencies are typically a reliable source of data, like the census and other things. Academic research is another credible, reliable source of data. Community-led initiatives are reliable sources of data. What I'd like to do is to help you to think about how you can pivot and find trustworthy data sources and not panic, because people are talking about data being taken away. So that is what we are saying at results achieved through community engagement means that we, as a health equity community, we have to pivot and not panic. And so when we pivot, we know that some federal agencies may be removing some key data sets. We need some alternative data sources. And so you may look at organizations like the Urban Institute, right? If you're looking for data. There's some trustworthy organizations like the National Indian Health Board. Black Mamas Matter is a looks at maternal health disparities. Local universities and community organizations that collect and publish their own data. Some national associations took down the data from the Centers for Disease Control and Prevention, and they're now publishing it on their own websites. So we have to pivot from those government agencies where we normally would get that data and not panic because of wondering what will we do with the data. I also want to share that as you begin to think about how will we use data for data-driven decision making if these websites are no longer available to us from the government, the first thing I want to invite you to do is to breathe. Breathe again. And pivot. Don't panic. Because you know your community. Your community can fill the gap with anything you need to know about their needs.
Yes.
Pivot and go to the core source of information, which are the community members themselves, and ask them about their community. If you think about it, most of the data on these websites is usually about a year or two old.
Absolutely.
With results achieved through community engagement, we use a framework called results-based accountability. We're some of the world's experts in results-based accountability. And the first thing that we do is create what results we want to see for our community or our patients or clients. And then we look at the data. Most of the time when we're working with organizations, that data is about a year or two old, community level data. And so the next thing we do when we create that trend line with the quantitative data, the numbers and the percentages, our next step is to look at the story behind the data. So you can still find out that story of what's happening in the community around that data. We've been talking about, let's talk about obesity, for example. All right, so you know the data on obesity or chronic disease in your community. It probably didn't change from 2024 to 2025 dramatically.
That's right.
So until that data comes back up in the numbers, go to your community members and they can share with you the most recent things that are happening. Oh, a grocery store just opened down the street. Oh, the food pantry opened up over here. The farmer's market started every month down. They can tell you, right? The health department can be a source of information at a local level to collect data and share data until we get back to the space. And it's going to happen. I'm an optimist. I'm an optimist. I will share as a faith-filled optimist that the data is going to come back.
It is. I believe it is.
And so in the meantime, let the community members and your organizations be those credible sources of data for real community needs.
Yeah, right now, New Henry County, we are in the process of planning. We will be getting our community health needs assessment very soon, and it's interesting because some of the sources that you have named are what we are utilizing in order to capture that data for our new community health needs assessment. One of the things I would also encourage people to look at is look at the non-traditional ways and ways that you can collect data from your community. And that would be go to your barbershops, go to your beauty salons, go to the nail salon, go to, to the local reading circle that they may be having. Go to some of the non-traditional, when you hear about certain community events that are happening that every year without a fail, you're going to that? Oh, I'm going to that. And you know for a fact that people show up those are places that you can go and get good data, and you can have conversations with people about, hey, have you heard about this? Or we're looking to investigate this particular thing. And you're able to get an accurate count. You also have a large population size in those spaces. One thing that I do in April, I'll be bringing it back, is I do a grocery giveaway every single year. Um, I last year I traditionally do it every single year, but because of all the weather disasters in Western North Carolina, I postponed doing the grocery giveaway that I normally do around Thanksgiving. So I'm doing it in April of this year. But we actually had someone reach out and was like, "Do you mind if we partner together so we can collect some data on that population?" That was last year. I had 1,000 people, excuse me, 2023, I had 1,000 people show up. Hopefully this year, I'm hoping to meet my number of 1,500 people to be able to provide grocery for. But those are different ways, just giving you some examples of that way that you can still get the data that you're needing for populations. So I love that. We also want to welcome those who are here with us. If you have questions, you can put those questions in the question and answer box that's at the bottom of your screen. That way we can address your questions within the next 15 minutes. We do have a question in the box now. This question says, how do you effectively disseminate and communicate the story with high context data to community members, funders, organizations, and et cetera, who may have difficulty in understanding processing the information? That is a great question. You also want to make sure that I say vested partners, I don't say stakeholders, but those who are tied into what you're doing, how do you communicate that information, Dr. Epps, in a way for them to be able to truly understand that complex data that you have actually gathered?
Yeah, so the first step to communicating to with community members is to engage the community in the development of the materials. So I started off today's webinar by sharing the importance of hiring people with lived experience uh, of the community as key partners. And so that's the first step, right? And so I'll start there, but we know that's, for me, that's the gold standard. So I've started with the gold standard. I'm like very transparent, results achieved through community engagement. That engagement is ideal when the community members themselves are leading the efforts. And so to disseminate and communicate the story with a lot of data to community members, funders, and organizations, I recommend using a culturally responsive approach, which means that you will have different presentations for different audiences.
Mm.
So the funders will want to see the information presented in a way that is relevant to them. Very different from the way you're going to communicate to community members. You might use infographics, one-pager infographics. No matter who you're presenting to, I always recommend that you have quotes and pictures from the people who are actually in the community or in your organization. And so when you say who may have difficulty understanding and processing the information, I invite you to flip that and to say it is the responsibility of the person who's disseminating the information to disseminate it in a way that it's easily understood and processed, right? So we're not blaming the person who is receiving the information for not understanding it. And this goes to, we're talking about health, this goes to patient-centered care, right? I'm a doula. So would you imagine that when I'm practicing as a doula that I'm talking like this, right? That I'm presenting the information the way I presented it here on maternal health? Absolutely not.
Right.
Absolutely not. So we have to be savvy. We have to be able to, this is a perfect question. I love this question because we have to be able to shift our behaviors based upon the differences within the groups that we're sharing with. And this is where we at Race for Equity have an expertise because we are cultural mediators, right?
Mhm.
We support people and organizations from different communities to come together in a way that they can see their cultural differences. And so that's what I invite the person with this question to consider. What are the differences that you can shift your communication tools so that they're meeting the needs based upon your different populations that you're sharing the information with? I hope that's helpful. I think it will be. If you have a follow-up question, please feel free to put it in the questions.
Mhm. I definitely, you're sharing so much great information, Dr. Epps, and I
Thank
hope
you.
others are finding this as much of a value that I am finding today. Um, the last question that I have for you is, what can I do to make sure my community's data is accurate and fairly represented?
Right. So at this in 2025, this is very important. And it goes
And
back to something.
and really quickly, I'm sorry. I should make that a little bit more clear. Is in my
Sure.
question more is about transparency and data, and so what are ways that the community can actually advocate for more transparency in data and advocate and data and advocate for fair practices. That's really more of a refined way of how I wanted to ask that question.
Okay, sure. And I can answer both. I'll start with the last one that you just shared about transparency in data and advocating for fair practices. Because communities can demand transparency, right? And so even as we're currently seeing some websites being like the I'll use the Centers for Disease Control and Prevention because we often refer to that data in our work. Um, and so we know that the community is concerned about the lack of access to this data. So communities can demand transparency. They can engage with their policymakers. They can push for ethical data collection. Like data is power. And
Mhm.
so, first of all, communities can advocate for better data equity by asking for public data. So push your local health department to release racial and geographic backgrounds and other differences, right? Whatever the differences are in your community, and that's just one example, two examples, but whatever the differences are, we need data for all of the people in the community. Equity is about the all,
That's right.
everyone having health and well-being. So ask for public data. I would also say advocating for fair practices means that you're going to need to engage your elected officials. So attending the town halls and asking how that data is used in decision making and making phone calls to your government officials at the state level, at the federal level, right? Because if the data goes away and there's no outcry, there's no public outcry, it's going to make it seem like it's okay. So it's
Mhm.
not okay just to complain on the side. It's important to share those concerns. Even, and as I mentioned earlier, community members can participate in focus groups, and they can be on an advisory board, an advisory board for their community. If your community has a task force and you're interested in you mentioned just a few moments ago, Fawn, you mentioned the community health assessment.
Mhm.
So community members can certainly find out from these are required across the country, so find out when are the community health assessments happening in your community. And even some indigenous communities in North Carolina and around the country, and we have someone here from Canada. Canada's has some great examples where indigenous communities are implementing data sovereignty laws to make sure they control their own health data instead of relying on state or federal agencies. So there's some things we can learn there about data sovereignty. So where we are ensuring that the people are controlling the data and not relying on state or federal agencies. So that's a little bit about advocacy. I do think it was important, the first part of your question, which was about making sure that I think you were asking about making sure it was accurate and fairly
Mhm.
represented.
Yes, ma'am.
And that's part of it, right? All of this contributing to community health assessments is really very important.
Yeah, it is. I think that one of the things I would strongly encourage those in community areas is now more than ever, it's extremely important that if you are a grassroots organization or you're connected to a grassroots organization or you know a grassroots organization, I would strongly would encourage you. Now is the time that you really need to become a lot more engaged with what's happening in your community. Show up to those community forums that are being held in those areas, and for whatever that's happening, whether they're trying to propose a new park or if they're trying to build a new recreation facility or things like that. Now more than ever is the time that you really need to become more engaged and show up, and then that way that is accurate data that is get don't you don't have to just go by yourself, where you normally might go to the coffee shop together, two or three or four of you out, four or five, you say, we're going to go over here and go to this event together. Make it a priority. Find out those things. These are public and that are publicly published, I guess you could say, or hearings and notices that go out on a regular basis. Your community that you live in, they have to put these notices out. Whenever things are being built into your community, they have to do a public notice and let these things, let you be aware of those things. So go and find out what are some new things that are being developed into your community. Is there another car wash that's being developed in your community? Is there, something else, another storage facility, any of those things? And if you want your voice heard, you all go together and show up and make sure that there's an accurate representation. You don't want for it to finally pop up, that new thing to pop up in your community. And you're like, where did that come from? We didn't ask for that. That's because no one showed up to voice their opinion about that particular thing. We have a question in our question and answer box. And the question is, do you have any recommendations for professional development trained focus on data skills?
Thank you. Yes, we Race for Equity, we actually offer training in using how to use data to make decisions and how to, again, results achieved is we are some of the world's experts on using data to drive decision making. And so you can contact me directly. Fine, if you can put my email in the chat, but it's
Okay.
Deitre at Race for Equity. DEITRE at Race for Equity. So what if you can consider.
Also, I have in the resources, if you all look at the bottom, there is a box that says resources. And if you click on it, it actually shows you a link for Race for Equity. You can click on that and it takes you directly to Dr. Epps' website. So if you don't have if you're not able to capture the email that I'm about to put in the chat, the link actually also takes you there too.
Thank you. Thank you. So yeah, so we offer training, and our training takes you through the entire process of with a culturally responsive approach. But you can, if you're listening to the webinar, you can connect with me directly. We're in the process of updating our deliverables to be responsive to what's happening right now. And so, but our training always, when we're looking at data-driven decision making, our training always includes why is it important? The things we've just been talking about, why is it important to break the data down into separate groups? How do we look at trend lines for our data? Any training that you take needs to also include the story, the qualitative, the story behind the data. And I love storytelling. I'm a storyteller. I come from a tradition of storytellers. And so, but hearing people's story will help you to understand what their needs are. And then we talk about, you're not in this alone.
That's
Our
right.
framework is very inclusive, that you bring in partners that can help support you in improving the data, and you come up with an action plan with those partners in mind and with those partners, so that, and the community voice is a part of it. Results achieved through community engagement. So the community voice is always going to be a part of it, so that your strategies are actually culturally responsive based upon who you're working with. So certainly reach out to me, and happy to tell you more about that training. Thank you for that question.
Do you have any final words that you'd like to leave with us, Dr. Epps?
My final word, I've spent a lot of time reflecting. I'm an extrovert, but I have introverted tendencies. And I have gone into my introverted self these last few months to really reflect upon how do I show up in these times and show up and still be in this race where results are achieved through community engagement, right? And so
Yeah.
the way I'm showing up is right now is to share with you what I am embracing for myself, which is to pivot into this away from polarization and judgmental stereotyping, but pivot to recognizing and accepting the differences and then looking at the data about those differences so that equity is about the all having health and well-being, regardless of what our differences are. Achieving health and well-being, using the data to show who the all is, that's what I leave with everyone today. So let's embrace that. Let's pivot to that acceptance and not panic about what's happening. And we're going to get through this in amazing ways. And we'll be able to tell our children and our grandchildren in New Hanover and other places that we were able to push through these turbulent times.
Dr. Epps, I want to thank you for such an engaging webinar and sharing so much great information. I also thank you for your calmness that you brought to this webinar, from the breathing exercise to your advice and guidance to pivot and not panic. That's extremely important. Regardless of the time that we're in, you can always pivot and not panic. So that way that we're being the center, the calm center, so we can make sure that we are getting the accurate data. It's fairly represented. It's inclusive of all of our populations that we are serving, so we can increase health equity, which is a fair and just opportunity for people to live their optimal life, right? And that's what it's about at the end of the day, is that people have a fair and just opportunity to live their optimal life. So I thank you so much for engaging with us and having this conversation. If you all have any additional questions, please reach out. I'll be happy to connect you to Dr. Epps and gather any additional information that you need. And we hope you have a wonderful weekend ahead. It's going to be a great weekend down here in Southeastern North Carolina. So people can get out and just feel the spring air. And if you're not in Southeastern North Carolina, we're so sorry for you. We love our beaches. So we appreciate it. And we hope you have a wonderful, see us next month. We have another great speaker to speak with us next month. But this was definitely one that we were looking forward to, and to end off Black History Month. So thank you so much. And we look forward to talking with you, engaging you again. You all have a wonderful afternoon, and we will talk with you again soon.